save this person's life versus, wait, cost. Do I get food or do I get medication?
Because of the healthcare I didn't receive, I really lost out on about 8 years of my life that I didn't have access to life and liberty and the pursuit of happiness.
It's sad, it's pathetic, and something needs to be done.
All units made it clear all.
In a so-called land of opportunity, 30 million Americans are denied access to healthcare. Medical bills are the biggest cause of bankruptcy in America. Obamacare established 3 goals for health reform as the beginning steps in the journey that leaders must complete in 2020.
It will provide more security and stability. It will provide insurance for those who don't. It will slow the growth of healthcare costs.
America wants to know what our leaders are doing to fix the healthcare crisis.
Just less expensive, easier to obtain.
It's too expensive. The quality of healthcare has overall gone down.
Both Republicans and Democrats agree healthcare is a right.
We've got to have healthcare for everybody.
All individuals should have access to coverage.
Healthcare will change the course of our country.
The poor use less healthcare despite having greater medical needs. As a result, they have twice as many avoidable hospitalizations.
Poverty is also unexplainable stress and a barrier to mental health progression.
Somebody hitting me with their car. Somebody was experiencing homelessness and experiencing addiction, had taken a bottle of painkillers. I really wonder how access to healthcare could have changed his life.
This gap in health infinitely leads to social inequities in education and employment.
How do we make sure that those children have access to quality healthcare is tantamount if we're going to care about closing achievement, inequity, and opportunity gaps. It really means that we have to do more when it comes to healthcare.
In turn, a right to healthcare is economically beneficial.
Healthier people cost less for government. You have less incidence of diabetes, hypertension. People are more effective at work, which means we're gaining more money, more tax revenue because of productivity, not because we're taxing people more.
The CDC says employees are more productive and absent less often with better health. For example, in Africa, malaria has slowed economic growth and dropped GDP. Where leaders are divided is how to achieve this right. Republicans believe government-provided healthcare will tarnish the economy and offer worse quality of care.
The one thing we shouldn't do is a Medicare for All plan that would not only blow up Medicare, but cost our country $32 trillion over the next 10 years.
The Congressional Budget Office projects government healthcare expenditure to increase to $1.3 trillion in 2029. Republicans point out the close to 2 million jobs that would be lost over the 4-year transition to Medicare for All. Many also worry that too much government healthcare will ration care and dilute quality.
The government says one size fits all. You can't buy insurance across state lines. Why not? Our healthcare system has the highest quality of care in the world.
Democrats say this rationing already occurs.
Clearly, we are rationing care. Insurers are rationing care right now. We are rationing care by leaving so many people uninsured.
Republican proposals will likely reflect common sense reforms discussed in the last race, which focus on creating competition to lower prices.
Common sense reforms that our nation can afford with a targeted approach.
Meanwhile, Democrats argue that some expanse of government-provided healthcare is critical.
Most Democratic candidates want the public option of universal coverage without eliminating private healthcare.
A public option would make it much easier for people to get into government-paid healthcare.
I think the Obamacare worked. We add to it, replace everything that's been cut, add a public option.
Medicare for all who want it.
The Medicare for All bill proposes that the government provides all healthcare services.
Business model of an insurance company. It's to bring in as many dollars in premiums and to pay out as few dollars for your health care.
In the long run, Medicare for All will reduce the country's overall health expenditures by about $500 billion a year. Out of 33 developed nations, the U.S. is the only one without some form of universal health care.
We spend 2.5 times per capita what other countries do. It's over $10,000 a year per person. How they do it is the same way we would do it. If you have everybody in one system, then you can negotiate prices with the leverage of everybody in.
Behind patient care are costly back-end functions, which can be centralized and reduced when parties working to make money off customer health are eliminated by Medicare for All.
Well, imagine the quality going up when more people have access to health services because we're not wasting money on bureaucracy and profits and marketing and executive salaries.
Medicare for All would also enact preventative care, including checkups and immunizations, which studies show reduces the need for expensive emergency room usage. Without access to preventative care, 46% of emergency room patients use the emergency room as their primary care physician.
Objective discussion of healthcare proposals in the 2020 race are critical to pushing for and achieving a right to healthcare.
Voters want public answers on how proposals will reduce prices.
To help themselves in the general election. Explain where they're going to get $1 trillion a year.
Presidential candidates need to be very clear on how their reform is going to save people money and guarantee health care. A lot of it's just obscured by talking points and political expediency.
Current discussion centers around increasing taxes, but has yet to explain the effectivity of tax increases to motivate listeners to trust Democratic plans.
When it comes to payment, they want honesty.
When someone is spending every penny they got to take care of their health, nothing else matters.
Healthcare!